guys have figured this one out, right? This is that activity which is 2 plus 2 equals what? 4. Yeah. Okay, you're looking at it, right? You see blood pressure in 2 different situations. You can change blood pressure in 2 different ways. Yeah. You can change it at the what? Vessel level. You can affect the smooth muscle and you can change it. This is how easy that decision is for that control center. So what will you do if that control condition has now high blood pressure and you want to decrease it? What are you going to do with the vessel? Are you going to vasoconstrict or vasodilate? Which one? You want to do what with blood pressure? You want to decrease it, right? So what are you going to do? Vasoconstriction or vasodilation? Vaso what? Vasodilate. And that's it. How about that? That's it. That's what the brain decided. That's it. Okay? And so that's what you're going to get. You're going to get a decrease in blood pressure when the smooth muscle does what? When it relaxes. See, that effector is going to relax in this situation and create a change of that internal environment back to what it was supposed to be. Yes? Mm-hmm. That's a response. At the end of that pathway, when the effector does what he's supposed to do, you get a response. Is that right? And so now, when we go back to looking at that control condition, that internal environment, who's going to take a look at it and detect what's going on with it? Whether there was a response or not, it's the what? Yes, it's the receptor. Okay? Don't forget, with homeostasis, pathway creates a response, has to go back to the receptor to see if a response was made correctly. Okay? So we're not done yet. We're not done with the process. We have to see if internal environment has changed back to what it was supposed to be. Okay? And so in this particular case, receptors pick up, yes, the blood pressure has decreased back to the normal limits. Control center gets information by way of a nerve that was the case. He says, because you know he's above himself. Yeah, I knew it. I did it again. Okay?
Oops.
Just ask me for any other questions if you have. Right? Okay. And so he then has these effectors calling for him, saying, "Can I keep doing what I'm doing? I like what I'm doing." And what does he say now? He says, "No." It's like that. Those actual troopers that want to barge into that house, right? In the military. The commander is the one that gives the decision, right? The control center gives the decision, and he tells those troops to do what? No, that's a negative. Okay? In military, they either say it's a go or it's a what? Negative. In this particular case, the commander says what? No, it's a negative. Okay? See, there was a feedback process that occurred. And initially, the control center said initially what? He said, do what I tell you to do. The feedback, right, is his decision once the receptors pick up whether there was a response or not. That's called a feedback, right? When he actually does what? Tells those effectors the second time whether you go and do it or you don't. Okay? So that second time around, when he tells that smooth muscle, okay, now you're going to stop relaxing, then he actually is giving a negative feedback. Okay? When he says no, when he said that's a negative, right? And then what happens? The vasodilation stops. In a negative feedback, typically what occurs is that you have your response, this particular response, going against what caused the problem in the first place. Can I say that one more time? Right? If you have the response going against what the stimulus caused, that's typically what you have is a negative feedback process. Okay? Right? Because once those receptors pick up that response change, right? They're going to send information to control center, and typically control center says, we can stop doing what we were doing before. It's a negative, right? Negative feedback. That's the typical process of homeostasis, okay? Again, underlying feature there, your response that's made through that first pathway comes back to receptors. And then receptors detect that what? That response has what? Gone against the stimulus. What did the response do? It went what? Against the stimulus. Very nice. Okay? And that's how that happened. In this particular case, for high blood pressure is supposed to be normal. Okay? However, brain detects that it's not the case, and then he actually goes to the effector, which is smooth muscle, relaxes it, vasodilation, decreases blood pressure, and now we're fine again. Okay? Negative feedback. Negative feedback. Very good. Okay? Versus for our what? Woman, you have a special process. You guys are an exception in certain situations. You know, there's this one I always like to show, you know, because it also puts an emphasis on how often will it happen, you see. Not often, you know. There's other issues, there's other feedback, positive feedback processes, right? But, you know, it puts an emphasis with this example how it's it doesn't happen as much as the negative, okay? Again, negative feedback happens more than the what? Positive. That's the typical one we'll come across as we go through the semester. Very good. So, with this positive, we talk about the woman who goes through what? Labor. When you will have your child. Anybody have any children? Okay, all right. This is what they experience. Okay? Again, our effector is going to be a smooth muscle. Do you have any control over it? No. Okay. But the stimulus is the child himself. And I know up to this point I said that the stimulus was doing something wrong. Okay? That's not always the case. Okay? That's a beautiful child. Child is actually doing what you call engaging. You know, engagement was when they started to do what? In this story, we're talking about a very important organ, which is the what? Uterus. In the Bible, it's called the womb. Okay? That's the place where the baby's going to be nourished and kept for how many months? 10 months or so, 9 to 10 months. All right, so what this uterus has is a wall, and in it is smooth muscle. Smooth muscle, again, smooth muscle. See, we had our smooth muscle and our negative feedback in the walls of the arteries. But for the uterus has smooth muscle in his wall too. Right? And what the uterus also has is an opening. Now, you got this sac that the baby's in. We do want to make sure it has an opening, right? Okay, because he has to get out. Okay. Yes. So yes, the opening is called the what? Who knows what the opening of the uterus is? Cervix. You never heard that? When they were coming in and out, they talking about, they may have said cervical what? Cervix is dilated this much. But we're getting to that, right? Cervix is the place the baby's going to come through. Small opening though. And in this opening, all right, what he has is surrounding it is receptors. Okay. So there we go again. Okay. Receptors are going to detect what? They're going to detect when that baby's head, that's where they come out first. Legs don't come out first. That's not good. Head comes out first. Head pushes on that cervix, and what's there? Receptors on cells that detect the stretching. Yeah. Cervix is stretching. Ooh. When baby's head's coming out. Now, we want the baby to come. Baby's ready to come out. So we want to continue that process. So that kind of takes us to what's going to happen next with our thinker, right? Receptors pick up that baby's coming out, the stretching, takes that by way of a what? Nerve to the what? which is called the control center in homeostasis. He's sitting there like, I know about this. I see what's going on. I know exactly what to do. Okay? He makes the decision. It goes by way of a what? Nerve to the what? To the effector. Again, the effector is the what? Smooth muscle. All right? And the smooth muscle is in the wall of the what? Uterus. So, what do you think? 2 plus 2 equals 4. Okay, just put it together. What do you think this smooth muscle is going to do in this particular case? Is it going to actually, let's make it easy. Is it going to contract or is it going to relax? You say contract? Anybody say relax here? You say relax, maybe? Okay. If it contracts, what does it do? To the baby, for the baby. The baby's in this sac. If you contract all that smooth muscle on the wall, what does that do with the baby? It pushes the baby? Is that right? Do you want that? Yeah, because at this time the baby's ready to come out. All right? The baby's ready to come out. All right? Very good. So we're putting together, we understand that when it contracts, that's a pushing process. All right? And so, yes, he's saying, okay, push, push, push. But guess what? Guess what? If the baby's coming out, right? What's that doing to the actual what? Because that's the response. The response is going to be that the cervix continues to what? Stretch. Baby's still coming out. That's the actual opening. So it's going to continue to what? Stretch. In this particular case, receptors pick up what? That it's continuing to stretch. That's their job. That's it. They don't think. They take information to the who? Control center. By way of a nerve. And what's that control center going to actually decide this time? See, those effectors are like, can I keep doing what I'm doing? Can I keep contracting? And what does he say this time when those troops want to come on in there? What does he say this time? He says, yeah, that's a go. He didn't say that's a negative. Is that right? He says that's a go. Yes, keep going. And you may say, well, why the heck? Especially the woman in labor, right? But he wants to have that baby where? Out. See, in this particular case, this response, which is the continuation of the stimulus, okay, is not being opposed by the response. See, in negative feedback, the response was going against the stimulus, which is the baby constantly pushing through that cervix, right? But in this particular case, which is positive feedback, when the actual brain says this is go, the actual response is what? It's strengthening the stimulus. What's the actual response doing in positive feedback? It's strengthening, supporting the stimulus. Supporting it. Not going against it, it's supporting it. And so, yes, in this particular case, things keep going. You keep getting the what? Muscles contracting. You know what that's like for her? What happened with her? If you would act, your muscles are contracting if you're running, right? Let's say you do that for about 10 miles. Then you start to what? The muscles start what? Hurting because they get fatigued. But then guess what? You got to go another 10 miles, right? Is that good? That feel good? No, right? So that's what she's done. That's what the woman you're going to have to go through, okay? And it hurts. It hurts. But the baby has to do what? Come out. And there is a what light at the end of the tunnel, because once the baby's out, is the cervix going to keep stretching? So eventually, right, all the positive feedback process was just to make sure that a certain situation was complete, and it will be complete, and eventually things will stop. Okay? Eventually, in positive feedback, it should stop, right? Because the whole purpose was just to complete the process. Okay? All right. So what we're going to peek at on Friday is, again, looking more into the receptor and looking more into the effect that's made after that receptor gets that information.